This racist is the reason that we don't have single-payer healthcare in America. This is Frederick Ludwig Hoffman. He's considered the father of modern insurance. So if your claim is under review or denied, you can thank this man. He wasn't even born in the United States. He's German. He was a vehement racist. He wrote the book, The Race Traits and Tendencies of the American and the Appreciation and Interest. He believed that Black Americans were genetically inferior. He argued that Black Americans were predisposed to disease and early death because of genetic inferiorities and not the lack of health care and resources at the time. He also said that Black Americans were predisposed to diseases like pneumonia and tuberculosis because their bodies were just weaker and couldn't fight them off. And people listened to him. He was one of the biggest medical voices for his time period. It got to the point where leaders in the Black community like W.E.B. Du Bois challenged him directly, saying that high mortality rates in their communities were because of a lack of health care, poverty, and discrimination. He was one of the first statisticians for the Prudential Insurance Company, and he used his position as a statistician to push the insurance company to issue higher premiums for African Americans. He hated the idea of a single-payer medical system. He did not believe that everyone deserved health care, and he said that on the grounds of morality, everyone shouldn't be given it. He believed that only those who could afford health care had earned it, and only those who had lived responsible lives should have access to the best health care. He also believed that it would undermine natural selection. He was a eugenicist. He believed that a single-payer system would interfere with God and the natural process and the natural order of people dying. When Teddy Roosevelt was elected president, the idea of a single-payer healthcare system was gaining full steam in America. And Teddy Roosevelt wanted to do it, and he wanted to push it on a federal level. Insurance companies sent this man all around America to drum up support against a nationalized healthcare program. Hoffman pitched the idea to people all around America that insurance was a moral duty and that insurance can solve all of your problems. And he pitched insurance as a public health tool, saying that it was a symbol of financial security and middle-class stability in an industrialized society. And not only was it a way of protecting against the unexpected, but it was a way of managing your future. He was also extremely anti-immigrant. He pushed the idea of racial hierarchies, saying that Southern and Eastern Europeans were genetically inferior than the rest of Europe. He pushed the idea that they were less intelligent and therefore wouldn't be able to contribute to American society, that they were a public health risk, disease-ridden, and a burden to the healthcare system. He also pushed racial purity and believed in genetic fitness and proposed that people be put through a racial purity and genetic fitness test before being allowed into the country. It's believed that Hoffman's views are the reason that the Immigration Act of 1924 was actually passed. The Immigration Act of 1924 dramatically reduced immigration from Southern and Eastern Europe, and it prioritized countries that were Nordic or Scandinavian or Anglo-Saxon. This man also said that immigrants should be sterilized before they come to America so that they did not have kids here. And he also pushed for sterilization laws nationwide, specifically against African Americans. This man held back public health in every way, shape, and form possible. And he used science, pseudoscience, to justify it. It was so deeply rooted in xenophobia, racial prejudice, and eugenics that some of the arguments that this man used over 100 years ago are still used today to deny single-payer healthcare.